Hello there, Baby Doc here with some sage advice for expectant parents and newborn healthcare professionals about lumbar puncture in neonates. A lumbar puncture in a neonate involves inserting a needle into the spinal canal to collect cerebrospinal fluid, CSF. The most common reason is suspected sepsis or meningitis, which can be caused by bacteria like E. coli, Streptococcus group B, or viruses such as herpes simplex virus. It should also be performed to check for congenital syphilis. Additionally, it is useful to diagnose subarachnoid hemorrhage, seizures of unknown origin, or certain metabolic diseases, as well as to evaluate the effectiveness of antibiotic therapy for a diagnosed CNS infection. The procedure is performed by positioning the infant in a lateral, on their side, or sitting position with knees tucked to their chest, which can increase the success rate. An assistant holds the baby very still. Next, the area is thoroughly cleaned with an antiseptic solution, and sterile equipment and procedures are used to prevent contamination. At this point, a thin, hollow spinal needle is inserted into the space between vertebrae, usually L3 to L4 or L4 to L5, to reach the subarachnoid space where CSF is found. A small amount of CSF is collected in 3 to 4 tubes and sent for laboratory analysis. Of note, it is important to administer pain medications per unit protocol prior to the procedure to minimize discomfort and stress for the infant. Dr. McGlinn has an amazing procedural skills video that will walk you through performing lumbar puncture on a neonate step by step. There are several key considerations and contraindications of neonatal lumbar puncture to keep in mind. The procedure should be deferred if the infant is hemodynamically unstable, in shock, or has signs of increased intracranial pressure. A recent seizure or focal neurological signs without imaging also warrant caution. In critically ill infants, it is often recommended to start antibiotics immediately and not delay them to wait for the lumbar puncture, but it should ideally be performed before antibiotics are administered to get the most accurate results. Lumbar punctures can have a high failure rate. No CSF is obtained, especially in small newborns. If the first attempt is unsuccessful, a senior clinician should be consulted and the need for the procedure reassessed. Ultrasound can be used to assist and improve the success rate. Be sure to like and subscribe to McGlinn Institute Neonatal and join me, Baby Doc, for more sage advice.